Halloween is a week and 2 days away. Dr. Neeson isn't here for her to yell at me about me saying that we're going to eat all the candy. But Dr. Abbott is here in her place from KCU Dental Health this morning, the Dental College, and thank you so much for being here. We're not talking about Halloween, but we are talking about October, of course, Breast Cancer Awareness Month, and we know that early detection saves lives, but honestly, if you have a breast cancer diagnosis, it can be overwhelming to have to think about anything else, but
Absolutely.
Dental health is certainly a major factor in making sure that everything that you are going through as a breast cancer patient goes smoothly, right, Dr. Abbott?
With any kind of cancer, that's first and foremost on your mind. But it's very important to realize that oral health is a big component of you being successful and not having as many complications during treatment for that type of a cancer. And breast cancer is a great example of that. So it's one of those situations where we encourage women and even men who are diagnosed with breast cancer to seek help from a dentist as soon as they get their diagnosis, because there's a lot that a dentist can do to minimize complications that happen in the mouth.
Yeah, and I didn't even know about that when you were saying, like, as soon as you get a diagnosis, you should go to the dentist, because there are some things that you all can do to just make sure that things go smoothly. And tell us about some of those.
So one of the most important things that a lot of people don't even realize is important is simply getting your teeth cleaned. So what that does is it minimizes the bacterial load that's in the mouth, and that can reduce either the incidence or the severity of mouth sores. It can help with having problems with dry mouth. And so it's very, very important to maintain that oral health before, during, and after treatment. So you definitely want to talk to a dentist who has experience with dealing with cancer patients, or if not, then that they're in close communication with your oncologist.
Absolutely, so that they can be in tandem with that. How can breast cancer treatments affect our oral health?
So one of the major ways I think that we see in breast cancer patients is the medications that they use, in chemotherapy in particular, are very cytotoxic. And one of the things that happens is it begins to, attack those rapidly dividing cells. One of those occurs in the mouth. So we get mouth sores, and those are called oral mucositis lesions. And they are very deep and very painful. So if we can really help by even just minimizing that risk, and also then minimizing the pain that would be associated with that, it's a huge help for them.
Oh, sure. Like, that's the last thing they need, is one more thing that's causing any pain or discomfort. What can patients do to protect their health during treatment? We were showing some of the things on our screen, and we can pop those back up, but there's some things we can do.
Absolutely. So I think one of the things that they can do is they can make sure that they're seeing their dentist. They can brush with a very soft toothbrush, and that's a very gentle brush, okay? It doesn't take a heavy hand. They can floss very, very lightly, and sometimes if they're having a lot of bleeding issues that might come with their chemotherapy, they might need to kind of tone that down, but that's something that they can talk with their oncologist, their oncology nurse, and their dentist about. I think another thing that the patients can do is they can rinse. A really good rinse is to take just like a teaspoon of salt in a glass of water, or if that's getting to a point where it's burning, then they can substitute baking soda for that as well.
Okay, fantastic. And you could also, even after treatment, it's not uncommon for some breast cancer treatments to see impacts to their oral health even after treatment.
Absolutely, especially for those that have metastatic disease. Then it increases the complications. So at that point, you would need to continue seeing your dentist on a regular basis.
Yeah, well, I know that you guys are always looking out for the health and well-being of all of us, but it's wonderful to have just some guidance of what to do if in the event that somebody is facing a breast cancer diagnosis, and they can certainly chat with you all if they need to know anything.
Absolutely,
else about it.
yeah.
Dr. Abbott, we really appreciate it.
Thank you so much for having me
this morning.